Data show a rise in cases across the country, which have doctors paying close attention. Mike McDaniel's joining us in the studio now with details on this new bump in cases. Mike.
Hey there, Katie. Well, doctors say we should also be paying attention to this as well. It's not time to panic, but a time to rather understand what's happening and how to protect ourselves, because this uptick is something doctors expect will happen again.
At LSU Health New Orleans, doctors are watching as COVID creeps back to the forefront.
There is certainly an increase in patients in the emergency department and an increase in the hospital.
Dr. Benjamin Springgate says right now those increases are not overwhelming the health system like they did in prior years.
It's premature to suggest that we're going to have a problem right now. The cases are still much lower than they were a year ago and 2 years ago. So we are confident that we're not yet in that type of a scenario.
According to the CDC, COVID hospitalizations and positive test results are increasing nationally. The most recent data from the Louisiana Department of Health shows COVID hospitalizations and reported positive cases have been climbing since mid-June. The current positivity rate is almost 19%. In mid-June, it was about 6%. Hospitalizations have doubled during that time.
We're seeing an increase that appears to be related to a cycle that is going to probably come to fruition every 6 months or so.
Dr. Springgate says this uptick is not because of a new COVID variant, but rather because Omicron is still in the community and highly transmissible. Even though social distancing and required face masks are things of the past, Springgate says COVID is still very much part of the present and future.
It's no longer the public health emergency that it once was, but it still certainly represents a health risk for people who have risk factors for more severe disease.
Springgate says anyone with chronic health conditions, older adults, and anyone immunocompromised should stay away from people who are sick and minimize possible exposure.
It appears to be for the foreseeable future that this is going to be a virus that we're going to have to deal with, and we anticipate this will be part of our regular milieu of viruses that we deal with from year in and year out.
Now, doctors stress that vaccinations and boosters are still very much a part of the fight against COVID. There is a new booster shot set to be available this fall. You can talk to your doctor about whether you should get it.